So ribs, classification of ribs, it is classified according to its articulation with the sternum as true ribs and false ribs. Okay, true ribs are vertebro-sternal ribs. Their anterior ends articulate directly with the sternum through the costal cartilages, and examples are first to seventh pairs of ribs. And false ribs, their anterior ends do not directly articulate with sternum, and examples are 8th to 12th pairs of ribs. Okay, these are false ribs. These false ribs are again of two types, vertebrochondral ribs and floating or only vertebral ribs. Vertebrochondral ribs, this classification is very important. It is important for your viva. In bone stable axial skeleton, there will be vertebra and ribs and cranial bones. Okay, so for bone stable viva, this classification is very important. Classification of ribs. So vertebrochondral ribs, costal cartilages join with costal cartilage of the next higher costal cartilage. Examples are the 8th, 9th and 10th pairs of ribs. And floating or vertebral ribs, here anterior ends are free. Examples are the 11th and 12th pairs of ribs. Next, according to the morphological features, we are dividing the ribs into typical ribs and atypical ribs. Typical ribs are 3rd to 9th pairs of ribs and they have same general features. And atypical ribs are the 1st, 2nd, 10th and 12th ribs, 10, 11, 12. Okay, they have different features than the remaining ribs, different than these typical ribs. So this is the classification. We are dividing the ribs into true ribs, false ribs. True ribs are vertebro-sternal ribs, 1st to 7th. False ribs are again of two types, vertebrochondral and floating ribs. Vertebrochondral are 8th, 9th and 10th rib, and floating ribs are vertebral ribs, 11th and 12th rib. Ribs are again divided into typical and atypical. Typical ribs are 3rd to 9th ribs. Atypicals are 1st, 2nd and 10, 11, 12th ribs. Okay. Okay, so what are the features of typical ribs? You have to know it first so that you can see the difference with the atypical ribs. So typical ribs have common general features. Examples are 3rd to 9th ribs. How will you hold it in anatomical position? Hold the rib in such a way that anterior end has a concave depression. See, this is the anterior end. It articulates with this costal cartilage. So here is a depression. Anterior end has concave depression and posterior end has globular head. Here is the globular head. Okay, so shaft is flat and convex outward. This is the shaft. Costal groove and sharp inferior border lie downward. Here is the costal groove and sharp border is lying inferiorly. Convexity of the shaft is directed towards the side of the rib. Okay. So this convexity is directed to this side, that is right side. So this is a typical rib of right side. Okay. So and tilt of the rib is tilted. This head end is slightly above than this anterior end. Okay. So tilt the rib. So posterior end lies at higher level than the anterior rib. So this will be the anatomical position of the typical ribs. Now we go to the atypical ribs. What are the difference among them? First rib, second rib, 10th, 11th and 12th ribs are the atypical ribs. First rib is shortest rib. Its head contains single facet. Neck is present. Tubercle has no non-articular part. Only a small articular part is present. Costal groove is absent. Angle coincide with the tubercle. And ossification centers, one primary center for the shaft is present here in first rib. And secondary center, one for the head, one for the tubercle. For second rib, Okay, it is head contain two facets, neck is present, tubercle has small non-articular part. Costal groove is small, ossification center, one primary center for shaft is present and secondary center, one for the head, two for the tubercles. 10th rib, head contains single facet, neck is present, tubercle present, costal groove is present. All of is almost similar to the typical rib except head contains this single facet. Okay. And ossification center, one primary center for shaft is present, secondary center one for head, two for tubercles. Here in first rib only one for the tubercle, one for articular part. Here only articular part is present. Next we go to 11th rib. Here also single facet. Here neck is absent, tubercle is absent, costal groove is faint, angle is also faint, and ossification center, one primary center for the shaft is present and one for the head. No tubercle, so no center for tubercle. Okay. Next we go to 12th rib. It is the smaller rib. Head has single facet, neck, tubercle, costal groove, angle, all is absent in 12th rib. Okay. An ossification center, one primary center for the shaft is present and one secondary center for the head is present. Okay, so these are the ossification centers. So we will discuss individual ribs in details. First rib is very important, its identification features, attachments are important. Okay. So first rib, identification features, it is shortest, broadest and most curved rib. Shaft is flat and has superior and inferior surfaces and inner and outer borders. Head has only one small facet. Tubercle has only articular facet, no non-articular area. There is no costal groove. Anterior end is very broad and thick. Upper surface shows two grooves separated by a scalene tubercle. Okay. See, this is first rib. It is the shortest and stoutest rib. Here is the head, neck, tubercle, only articular area is present. This is upper surface and below will be the lower surface. Here is the inner border and this is the outer border. And this is scalene tubercle. On two sides of the tubercle, two grooves are present. Anterior groove is for subclavian vein. Posterior groove contain the subclavian artery and lower trunk of the brachial plexus. Okay. And this scalene tubercle, it provides attachment to scalenus anterior muscle. Okay. So how will you hold it in anatomical position? Hold the bone in such a way that upper surface with two grooves facing upward and forward, making an angle of 45° with the horizontal plane. And rounded head lies posteriorly and broad anterior end lies anteriorly at lower level than the posterior end. Convex outer border faces towards lateral side of bone. And how will you decide the side? You place the first rib on a flat surface. Okay. If the two ends are touching the ground, then it is side is correct. Okay. So if you keep the first rib on table in correct position, both ends will touch the table. And if wrongly placed, you can turn it opposite side. It will not touch the table. Okay. So see here, this is first rib and this is typical rib. You have to place this costal groove below and sharp border is below. Convex surface towards the lateral side. This is anterior end. Here is posterior end containing two facets for the head, neck, and here is the tubercle. Tubercle has articular part and non-articular part here. Okay, smooth part is articular and rough part is non-articular. So this will be the position of the typical rib. Anterior end is lower than the posterior end. Now for first rib, it is more tilted than the typical rib. If you place it on a flat surface, If I place it like this, two ends are touching the floor. Okay, so huge. Okay, so this is a first rib of this left side. Okay, and hold it with the same hand to which side it belongs. Head will be above, anterior end will be downward, and the flat surface of the rib will form a angle of 45 degree with the horizontal plane. So this will be the anatomical position of the first rib. And along the inner border, here is one scalene tubercle, and in front of it this groove is for the subclavian vein, and posterior to it this groove is for the subclavian artery and lower trunk of the brachial plexus. Okay, and in front of this neck of the rib there some structures are related, I will discuss. And this is the tubercle. Tubercle has only articular part. Okay, and head is globular. So this is a first rib of left side. Okay, understood? So you will be able to hold it in anatomical position. You place the rib on a flat surface. When the two ends are touching the ground, so the rib belongs to that side. So this is first rib or anatomical position of first rib of left side. Okay. So this is first rib, it has an anterior end, it is broad and thick, forms the first costochondral joint. This is primary cartilaginous joint. This type of joints are important. Okay, first costochondral joint is primary cartilaginous joint. Posterior end shows head, neck and tubercle. Head is small and rounded, has single articular facet, articulates with body of first thoracic vertebra. Neck is rounded and elongated. So this is neck. Okay. Next we go to posterior end. Relations. Anteriorly, the neck of first rib is related from medial to lateral. Here, on the anterior surface of the neck, from medial to lateral lies this sympathetic chain, first posterior intercostal vein, superior intercostal artery, ventral ramus of the first thoracic nerve. Okay, so you can remember like this: sympathy provides superior vision, or you can make your own mnemonic. Okay, sympathetic chain, then the vein, first posterior intercostal vein, then superior intercostal artery and ventral ramus of first thoracic nerve. This is very frequently asked in your viva. Relations of neck of the first rib. Okay, understood? Next we go to the tubercle. Here is the tubercle. Tubercle is large, coincides with posterior angle of the rib. Rib has two angles. Here the sharp bend is occurring posteriorly. This is posterior angle. And here in this region where bend is occurring, this is anterior angle. So tubercle is lying at the posterior angle. In typical rib, tubercle is lying proximal to the angle. Okay. So in first rib it coincides with the angle. So tubercle is large, coincides with posterior angle of rib, has only articular part, articulates with transverse process of first thoracic vertebra, and lateral costotransverse ligament is attached to the tubercle. Okay. Next we go to the shaft. Shaft, its relations we will discuss. Shaft is flat from above downward, has superior and inferior surfaces, and outer and inner border. This is outer border, this is inner border. Superior surface has two shallow grooves separated by scalene tubercle lies near the inner border. Here is the scalene tubercle where scalenus anterior is attaching. And these are the two grooves: anterior groove containing subclavian vein, posterior groove is containing subclavian artery and lower trunk of the brachial plexus. Now go to the attachments. Scalenus medius inserts on the elongated rough area behind the groove for subclavian artery up to the tubercle. See, this is the insertion of scalenus medius. Scalenus anterior inserts on scalene tubercle. Here is the scalenus anterior. And subclavius originates from the lateral part of the anterior end. Here, subclavius muscle is originating from the first costochondral junction, at the junction between the anterior end and costal cartilage of first rib. Okay, understood? Next is one ligament is present. Costoclavicular ligament extends from medial part of anterior end to the medial end of the clavicle. Here, costoclavicular ligament, medial part of anterior end to the medial end of the clavicle. Inferior surface, so we have completed the superior surface. Next we go to the inferior surface. It is smooth and does not have any costal groove. Relations, it is related to costal pleura. An attachment, it gives origin to internal intercostal, and intercostal is intimus muscle. These two intercostal muscles are attached over the inferior surface. Okay. Next we go to outer border. Outer border is convex outward. Attachments are external intercostal muscle and first digitation of serratus anterior. Here is first digitation of serratus anterior and external intercostal whole of the outer border. First digitations of serratus anterior originate from outer border just behind the groove for subclavian artery. This is groove for subclavian artery, just behind this groove it is originating. Next we go to inner border. This is inner border. It is concave inward and shows scalene tubercle along superior surface. Here is the scalene tubercle. Attachment is suprapleural membrane or Simpson's fossa. Okay, this is very frequently asked. What is suprapleural membrane or Simpson's fossa? It is attached along the inner border of the first rib. Okay, it is covering the apex of the lung, Simpson or suprapleural membrane. Understood? Okay, so to summarize the first rib, it is the shortest, broadest and flat rib. Ends, it has anterior end is broad, posterior end contain head, have single facet, neck is rounded, tubercle has only articular facet. Surfaces has upper surface and lower surface. Upper surface, anterior groove for subclavian vein, posterior groove for subclavian artery. Subclavian tubercle provides attachment to scalenus medius, okay, posterior to the groove for subclavian artery, and scalenus anterior attached to the scalene tubercle, and subclavius muscle originating from first costochondral junction. Lower surface smooth, no costal groove. Borders, outer convex border gives attachment to external intercostal, and serratus anterior first digitation takes origin from outer border. Inner border is concave, provides attachment to suprapleural membrane. Okay, understood? So it is flat from above downwards, first rib. Okay, so we have completed the first rib. Next we go to second rib. Second rib, its length is twice that of the first rib. Here is the second rib. Okay. Shaft is sharply curved but not twisted. Head is small, carries two facets. This is head carrying two facets. Tubercle has non-articular part is small. This is tubercle have both the parts, articular and non-articular, but non-articular part is small. Shaft middle of outer surface has typical large rough tubercle that gives attachment to serratus anterior. Here, this rough area gives attachment to serratus anterior. Outer surface faces upward and outward. Okay. What are the features? Inner surface faces downward and inward. Short costal groove on posterior part of inner surface is present. Scalenus posterior and serratus posterior superior insert on the upper border on the posterior part here. scalenus posterior and serratus posterior superior attached over here, inserted over here. Okay. Okay, so you see the second rib. See, this is second rib of left side. Convex surface is facing upward and laterally. Concave surface is facing downward and medially. Okay, and in the posterior part, small costal groove is present. Here is the tubercle having two parts, both articular and non-articular, and head containing two facets. Okay, and it is almost twice the length of the first rib. And this is rough area where serratus anterior muscle is attached and other two muscles are attached over here. Okay, understood? So this will be the anatomical position of the second rib. Always for rib, anterior end is lower than the posterior end. Okay, and this posterior end is placed more medially than this anterior end, because along the anterior end there is attachment of costal cartilage. So it will keep the anterior end away from the midline. So this will be the anatomical position of the second rib. Understood? Okay, next we go to the 10th rib. Okay, 10th rib, this is second rib actually. So 10th rib, head has single articular facet, articulates with 10th thoracic vertebra, and length is shorter than the typical rib. Only difference is this, you remember this point to identify 10th rib. Head has only single articular facet, articulates with the 10th thoracic vertebra. Okay, understood? Next we go to 11th rib. What are the identification features? Head has single large articular facet, neck is absent, tubercle is absent, anterior end is pointed, angle is faintly marked angle on the outer surface is present. 12th rib, identification features: head has single facet, anterior end is pointed, neck, tubercle, angle, costal groove all are absent in 12th rib. Okay. Okay, 12 ribs have multiple attachment. We'll discuss it. Okay. So see here, how will you hold it in anatomical position? Okay. So this is 11th rib. You place it like this. Concave surface is above. Okay. Convex surface is laterally and downward, and anterior end is directed laterally. There is no costal cartilage attachment. Only tip is covered by a very thin layer of cartilage. Okay. And head has only single facet. Okay. So this is 11th rib. 11th and 12th difference is only in the length. Okay. 12th is smaller in size. 11th is lengthier. This is 12th rib. This is also, it is 11th rib of left side. So you will hold it like this. Posterior end is higher than the anterior end, and anterior end is directed laterally. Concave surface is above, convex surface is downward and laterally. Okay, so this is 11th rib of left side. So you understand the anatomical position? Yes or no? Okay. Next we go to the 12th rib. Here also head contains a single facet for articulation with body of 12th thoracic vertebra. Here also concave surface is looking upward and tip is not articulating and it is floating and directed laterally. Okay, and all the other features of typical ribs are absent. No neck, no tubercle, no costal groove, no angle. Okay. Okay, now we go to the attachments of 12th rib. So side determination and anatomical position hold the bone in such a way that pointed end is directed forward and laterally, sharp border is directed inferiorly, concave inner surface is directed inward and slightly upward. Okay, concave inner surface is directed inward and slightly upward, and convex outer surface faces side of the bone and will determine side to which the bone belongs. Okay, convex outer surface faces towards the side of the bone. Okay, these are the attachments and relations of the twelfth rib. This is we are viewing from the inner surface, and this is on the outer surface, view from the outer surface. So you see the attachments, latissimus outer surface. Okay, so this is outer surface. You can see the attachments here. Here is attachment of latissimus dorsi, external oblique, serratus posterior inferior, longissimus thoracis, erectus spinae, levator costi. Okay, and these are the attachment of costotransverse ligament, and here is lumbocostal ligament. So these are the attachment of this outer surface, and also there is attachment of middle layer of the thoracolumbar fossa. So latissimus dorsi muscle originates from upper part of area near the tip of the rib. Here, upper part of the area near the tip of the rib. External oblique originates from lower part of the area near the tip of the rib. Erectus spinae and levator costi insert on the medial half of outer surface. Okay, erectus spinae and levator costi, medial half of the outer surface. Serratus posterior inferior insert in lateral half of outer surface. Here is serratus posterior inferior. Okay. Next we go to the inner surface. This is inner surface. Here is attachment of quadratus lumborum. Here is internal intercostal muscle. Here is diaphragm, lateral arcuate ligament, posterior layer, middle layer and anterior layer of the thoracolumbar fossa. All the three layers are attached in this inner surface. Okay. Thoracolumbar fossa has three layers. So inner surface, quadratus lumborum, here is quadratus lumborum inserts on the lower part of medial half of inner surface. Internal intercostal muscle insert near the upper border. Here, internal intercostal. Diaphragm originates from anterior end of inner surface. Here is attachment of the diaphragm. Upper border, external intercostal inserts and internal intercostal originates from the upper border. Here insertion of internal intercostal has been shown. Next, along the lower border, these ligaments are attached. Lumbocostal ligament extends from head of 12th rib to the transverse process of L1 vertebra. Lumbo means lumbar attached with the costal facet. Okay. Ribs are developing from costal element, that's why the name is given, lumbocostal ligament. Here is the attachment of lumbocostal ligament, extends from head of 12th rib to transverse process of L1 vertebra. Next is lateral arcuate ligament, extends from middle part of lower border to tip of the transverse process of L1 vertebra. Okay, almost nearly in this region, attachment of lateral arcuate ligament. Middle layer of thoracolumbar fossa, here is attachment of middle layer of the thoracolumbar fossa. Important relations, inner surface is related to costodiaphragmatic recess of the pleura. Okay, oblique line on the middle part of inner surface marks line of pleural reflection. Okay, so this rib is related to the costodiaphragmatic recess of pleura. In hydrothorax or pneumothorax, pyothorax like this, you have to insert the needle into this costodiaphragmatic recess to drain the fluid. Okay, fluid or air. So this is enlarged view of different attachments. Next we go to the clinical aspect. First is cervical rib. Cervical rib comes as a short note. Okay, cervical rib, important clinical aspect. Lies at the root of the neck. See here, generally ribs are starting in the thoracic region from T1 to T12. Okay, but if in the cervical region, Generally in the 7th cervical vertebra, if one rib is present, that is known as cervical rib. So it lies at the root of the neck. Incidence it found in about 0.5 to 2% of individuals. Embryological basis, elongated costal element of C7 vertebra may be unilateral or bilateral, may have free pointed tip, or its tip may be fused with first rib. Okay. Effects, it may compress lower trunk of brachial plexus and subclavian artery. What are the symptoms? There will be pain along the medial side of the forearm and hand, wasting of the intrinsic muscles of the hand. So these are the symptoms of cervical rib. Next clinical aspect is rib fractures. What are the common sites of fracture? Angle of the rib is weakest area of the rib. Okay, there is sharp bend near the angle. So this is most commonest site of fracture. And if fracture occurs, which structures will be damaged? Fracture rib may damage the pleura, lungs, liver, spleen, diaphragm, and so on. All these structures can be damaged in rib fracture. Lumbar rib, also called gorilla rib, develops from costal element of L1 vertebra. Okay, there is no such symptoms like the cervical rib. Cervical rib is important because it may compress over important vessels and nerves like this. That's why there will be symptoms in cervical rib. Next is flail chest. Uh, in case of multiple fractures of a rib, segments of rib moves freely and paradoxically moves inside during inspiration and outward during expiration. This segment is called flail segment and it should be treated surgically with plates or wires. Okay. Rib excision, access thoracic structures in surgeries such as pulmonectomy. In removal of the lungs, there may be required of rib excision. Okay. Now we go to the ossification of ribs. For typical rib, all the typical ribs, 3rd to 9th and 10th rib, ossify from one primary center. For the shaft and appears at 8th week of intrauterine life. And 3 secondary centers appear at puberty as follows: one for the head, one for articular part of tubercle, and one for non-articular part of the tubercle. These are the 3 secondary centers for typical ribs. And secondary centers fuse with the rest of the bone between 20th to 25th years of age. First rib has only one secondary center for tubercle because it has only articular part. That is the difference from typical rib. And 11th and 12th rib has only primary center for shaft and one secondary center for the head. It does not have any tubercle, that's why no center for tubercle, only head. For head one center is present. Okay, so this is ossification of rib. So you have to know the identification points. First rib is very important. Okay, and others you just know the difference from typical ribs, and you will be able to hold it in anatomical position. I am showing you again. So first rib, for first rib you place it on a flat surface. If the two ends are touching the floor, it is in correct position. So if you place wrongly, head will be not touching the ground. Okay. So it is a first rib of left side. And on the upper surface you can see the grooves for subclavian vein, subclavian artery and scalene tubercle at the inner border. Okay, so it has upper surface, lower surface, inner border, outer border, anterior end, posterior end, head, neck and one tubercle containing only articular part. So this will be anatomical position of first rib, and this anterior end is more lateral than the posterior end, and the plane of the rib is forming an angle of 45 degree with the horizontal plane. So this will be anatomical position of first rib. Next we go to the second rib. Here it is convex surface is directed upward and laterally, concave surface is directed downward and medially. and there is a small costal groove in the posterior part. It has an anterior end, posterior end. Posterior end is containing the head, containing two facets, neck and tubercle. Tubercle has both parts, articular and non-articular. Okay, and here is a rough area for serratus anterior. So this is the anatomical position of second rib. Anterior end is lower than the posterior end. Anterior end is more lateral than the posterior end. Okay, understood? So this is second rib of left side. Next we go to the 11th rib. 11th rib you place it like this. One single facet. 10th rib, only difference from typical is it has only single facet. Okay, over the head. For 11th rib, it does not have any tubercle and head has only single facet. Tip is directed laterally and forward. Concave surface is directed upward and medially. Okay, and convex surface is directed downward and lateral, and its length is more than the 12th rib. So this is anatomical position of rib, 11th rib of left side. Okay, next we go to 12th rib. It also contains a single facet near the head. Tip of the rib is non-articular and directed forward and laterally. Concave surface is directed upward and medially. Convex surface is directed downward and laterally. So this will be the anatomical position of the 12th rib. Okay, understood? And for the floating ribs, the tips are embedded within the abdominal flat muscles. Okay, and no costal groove, no angle, no neck,